The main thing is that because I'm relatively new to this field, I'm really interested in using evaluation methods that are focused on empowerment, building trust with communities, and that aren't necessarily like written surveys. There is definitely obviously value and a lot of information you can get from written surveys, but I often find that written surveys are very individualistic, whereas interactive and empowerment-based evaluation methods are collaborative. And so just in that alone, you know, the difference between silently on your own writing a survey and working with people to develop strategies that you can put into action makes a huge difference in the amount of data and like the depth of data that you can collect with people. So the one specifically that I wanted to focus on today was activity-based assessment, because I think there's so many different types of activities that people can and should be evaluating, and I've really enjoyed learning both through my supervisor and through practice and through a lot of the amazing publications that come out of PCAR and NSVRC around all of those things. I work statewide, so I usually travel to communities, and a lot of times because I'm doing community-based work, the access to technology is really different in different places. So a lot of times I just very actively try not to rely on technology. So I don't do a lot of PowerPoints, and also I don't like that PowerPoints aren't necessarily accessible or engaging to people. So instead, I buy a lot of wall notes. And so I'm able to like pre-make a lot of the wall notes similar to how I would make a PowerPoint, and then I'll make sure that, you know, different wall notes have different activities for us to do, right? Sometimes it's as simple as putting up a question that is like, what are healthy relationships, or what is healthy sexuality, and posting like a couple of them around the room and asking people to go around and just basically fill in the blank on the wall note. I really enjoy doing that because it allows participants to kind of give semi-anonymous feedback, right? So like we don't know specifically which participant said what, but it still gives us a lot of information. Participants are aware that the information that we just gathered is from the room itself, so we can actually talk about it, and people can give input about their answers without necessarily being tied to their answer and stuff. Also, that's really convenient because it doesn't put me in a place where I'm paraphrasing or rewording things from my own perspective. You know, I'm actually actively using participants' language and words to talk about what we did in the workshop. Sometimes other ways I've used wall notes is a while back I did a workshop around how different communities might use different language or have different ideas about how to do leadership strategies and implementation. And I had us do like different spectrums of like, some communities prefer title-based power, right? Like what title you have dictates your speaking ability in a room, whereas other communities value experience-based power, you know, and your level of involvement in the community and your personal relationships dictate more of your power relationship in the community, right? So, and so what I asked people to do was just use sticky notes to put where they think they prefer, like how do they feel about these different leadership qualities, and then we did it again with like taking off the stickies and putting them back about where do they think the community stands on these things. And I could take pictures of all of it, right? So it gave us an opportunity to talk about why is there incongruence between what you want and what really is happening, and how are you considering that, and how does that play out in the real world in the organizations we're part of and stuff. So those are ways I've done data collection with note taking. The other thing, since our program is an arts-based program, and I really enjoy doing theater of the oppressed and like non-traditional interactive theater activities, there's one activity in particular that I actually have pictures for. Was last year I got to implement an activity called the 4 Commitments, which I did not create. Theater for Social Change in Wisconsin. It's run by Mark Weinberg and Jenny Wanasek. They're good friends of mine, and Mark is also on the board of Pedagogy and Theater of the Oppressed. But anyway, they lent me this activity called the 4 Commitments, and what you do is you ask people to figure out what is your first commitment in life, the thing that you're really wanting to do. Are you wanting to contribute to positive social change, or be a better leader, or be a healthier partner in your relationships, you know, like anything like that. And then the second commitment is, what is your competing commitment? So if your commitment was to be a better partner, your competing commitment is you have to work 2 jobs in order to make an income. And these are like physical, substantial limitations to our lives and all of the commitments that we have. And then the third commitment is I'm scared that if I put more effort into the first commitment, this is what will happen to the second commitment, right? So like if I put more time into my relationship, I'm worried my job will suffer and I won't make as much money or I'll get fired, whatever. And then the last fourth commitment is talking about what is a realistic possible solution or compromise that you can take one step towards going towards that first commitment. And so there's a lot of different ways that you could collect or do that or whatever with a group. But the way that we did it is I had people, again, semi-anonymously put up sticky notes, and then they could add as many as they wanted, so there didn't necessarily have to be like one per person or something. And then ultimately, because we were doing a group work, I had people come to a group consensus about what was the overarching commitments for each category for the group that we were experiencing, and then we used those commitments to create images for like an image theater. And we were able to then it was just really interesting because there was so much in the images, and because I'd been working with each of the groups for a while, they were comfortable with me taking pictures and stuff. So I have these really fantastic pictures of people making really interesting images about the different competing commitments and contradictions in their lives and how they can be healthier, contribute to healthier communities that they're in. In terms of needs assessments, typically what I do for that is, for me, the needs assessment is more of a proactive thing that I do before I even make my objectives or anything else, right? So like ideally and hopefully, and particularly since I've been working in these communities for about 3.5 years or something now, I'll make an active effort to keep meeting with people, finding out what's going on in the community. What are they actually interested in working on? Because a lot of times, if I go in with my own agenda, people aren't necessarily interested in that agenda. It helps me understand both what are the needs in the community, what are the strengths in the community, and how are they already working on both of those things. So I don't usually typically very directly use Walnut activities for needs or strengths assessments, but instead what I'll end up doing is using it to kind of gauge where are there gaps or strengths in terms of understanding issues around sexual violence, direct or peripheral attitudes around sexism, racism, directly sexual violence, any of the things that we would consider like risk or protective factors for sexual violence, like those things, as well as people's attitudes toward them. Sometimes we'll do things that I can gather information through Walnotes about what do people want to do or think that they would want to do in various situations. And then sometimes we can actually collect information about like what are people doing now, what are their skill sets and things. The workshop series I did last year with communities in a few areas of Indiana, the last session, like half of the session was just having people write on Walnotes like what organizations are you part of, what are you doing, what do you want help with? Because it was a really great opportunity for people to actually meet each other and figure out, oh, you're doing Women's League of Voters and I'm doing like empowerment work with LGBTQ folks, like we should be working together, this is awesome. So I think that there's a lot of different ways to use it. As part of this workshop series for last year, I was working with a group and we were doing Walnotes, and one of them just had the question about what do healthy relationships look like. There was another one about what does healthy sexuality look like. While we did those questions, the way I facilitated that activity, I was actually writing as people were speaking, but I was very deliberate, obviously, in writing exactly what people said. I wasn't like interpreting or something. I think it's a really important ethical thing whenever people do take notes in a group setting, that it's like reflecting people's words. Yeah, I think it's really important to reflect what people are actually saying, because I think the language is so important, and word choice is so important for conveying people's like very specific connotations and meanings. And I think by having people write in their own words, or you as the facilitator writing specifically what people say, you're honoring and respecting people's own past and history, and how they've come to this work, however, whether that's paid work or not, whatever. But also specifically, I think it's a really important trust building exercise with participants. I think a lot of times if as a facilitator you reword what people have said in writing, it often can make it seem like, or it might feel like to the participants that their words are not good enough, they don't have enough formal education or something like that in order to contribute to the conversation. And we know that literally everybody can contribute to sexual violence prevention or any type of violence prevention. So for me, it's also a method to like empower people to use their own words and to continue participating. So I think for all those reasons, it's really important. So I think for one thing that in most fields that become professionalized, like violence prevention, there's too much emphasis on formal education. So first I want to say that you don't have to have formal education in any type of social change work to be effective at social change work. Besides that though, I do think that it is valuable to read and participate as much in these types of methodologies as much as you can before you do them. I think two great places to start with reading are on the Pennsylvania Coalition Against Rape's like online library. There's this incredible 4-volume publication around evaluation that, like, if you're unfamiliar with evaluation or you're just interested in learning about public health models of evaluation, it's so informative and helpful, and it really helped me understand where people are coming from. The second resource is TASA, which is the Texas Association Against Sexual Assault, and they actually published a document titled something like activity-based evaluation or assessment. And that is also phenomenal because it's incredibly concrete. It actually, the booklet itself is like a workbook, so you can go through and practice what you're gonna do. I know in my own experience that even after doing the workbook for different things and then actually practicing it, of course it was much more complicated, I felt like initially to start implementing, but just having the opportunity to practice and have guidelines really helped me develop evaluation practices for myself in the work that I was doing. Besides the reading, I really think that the two most necessary skills for doing activity-based assessment, because you're so focused on empowerment, are facilitation and communication skills. And I think part of that is having an intentionally like anti-violent framework and a framework for deep listening. I think one of my personal strengths is communication and facilitation, and one of the things that I really enjoy is making sure that participants know that I am like extremely with them and I'm interested in knowing about them, what they're doing, how they're doing in the workshop, whatever else like that. So I think just those types of facilitation skills and coming from a framework of anti-violence is really important. One concept I think that's been really helpful for me that I learned from Paulo Freire, who wrote Pedagogy of the Oppressed. He has this idea called mutual humanization, which is the idea that violence inherently dehumanizes both the person who is experiencing oppression or violence and the person who is perpetrating that oppression or committing the violence. And so mutual humanization is the antithesis of that. It's a process in which both people become human because we can recognize the power dynamics that are happening, and we are making an intentional effort to have respect for each other as people, regardless of our positionality. And so mutual humanization, at least for me, has been something that like deeply guides everything that I do in terms of facilitation and evaluation. And just making sure that all of my evaluation practices, particularly in activity-based assessments, are always focused and informed by the participants that I'm working with. Yeah, I think people from like any field or profession or anything always seem overwhelmingly interested in different forms of evaluation, because in reality almost nobody likes creating surveys and people don't like doing surveys very much, right? Especially if they're like long or something. So I've had a lot of people be interested. I think the misconception is that activity-based assessments or like non-survey methods of evaluation will somehow be more challenging to process or present. And in my experience, they're not any harder to process or present, but they do require more intentionality and effort in terms of the actual data collection. Because to me, the point is a lot of activity-based assessments inherently lend themselves to being anti-oppressive. And in order to do anti-oppressive and anti-violent work, you have to have also taken time to self-reflect on yourself. What position are you coming to people to? What does it mean for me to do anti-oppressive workshops as a trans person and also as a white person simultaneously? And so I think people unintentionally kind of get scared away or don't know how to do things, but they're actually focused on the wrong part of it that's challenging. So, and in my experience, particularly with providers, the big thing that determines whether or not they're really meaningfully interested in activity or in empowerment-focused evaluation is whether or not they see themselves in their position as someone there to save marginalized people or actually work with them. I think a lot of people in helping professions get in those positions to work with people and serve them, but there's actually, while it probably seems minor or nuanced, there's a very big difference between people who are there to give charity and people who are there to empower. And so people who are really there to empower a lot of times are like very hungry for ways to do the empowerment while doing evaluation, while meeting their grant objectives. Whereas folks a lot of times who are just there like, oh, poor, low-income queer people, will help you with that. It's very different. So I think that's the biggest determining factor I've seen. So I want to look at how I can actually present the data in a more graphic way, because right now a lot of times whenever I submit reports at the end of the year or whatever about this is what we did and this is what we accomplished and this is what was really challenging, it ends up all being very written. And I'm really good at organizing the report so at least it's visually appealing, but it's still so much reading and it's so much writing for me and the staff in our program. So I'm really interested in finding ways to make it more either literally some types of graphs or just imagery or word clouds or things like that are more creative ways to demonstrate something that we achieved. But also something that I think in thinking about how to process different forms of the actual data collection, a lot of times I'm trying to combine the imagery with also the discussion we have. So there's a component of observation-based evaluation also with that. And I'm trying to look also for patterns across different groups if I'm working in different places, or if there were sticky points that we got to in every group, and also also always simultaneously trying to reflect on, was the challenge in the workshop a reflection of my inexperience with something that I facilitated, or was it or maybe the curriculum wasn't designed well, or was it actually that the community readiness wasn't there for that topic or something, right? And then I think kind of the last component in terms of data processing is that, our grant cycles are 1 year. And a lot of times what I find, I actually just got an email today because from the workshop series I did last year in Northwest Indiana, out of that workshop series, some folks came together and actually created an LGBTQ sexual violence prevention and intervention coalition, which was really cool. And it's still happening, it's still growing, which is so awesome to see that happening. And to me, that's a very high level, long-term outcome that resulted just from our education and our support and technical assistance. But it's not necessarily something that I can always write about. But sometimes I think also going back and looking at the data we collected and being able to look at the longer term outcomes also helps put it in a lot of context about what was happening and what did that actually result in terms of outcomes as well. So, MESA just got published in the resource, and the article was about essentially how to do empowerment-based and culturally affirming evaluation, data collection, how to do the data collection. And I think that the article was incredibly important because, and that topic is really important because a lot of times data collection is seen as a necessary evil of programming and grant work, and it's also seen as something to just quickly get out of the way, and it's not usually, but it's often something that programs develop after the programs that they want to implement have been developed. They're like, oh, well, how do we measure this now? And so I just wanted to mention that whenever people are initially writing their grant objectives or their program objectives or whatever else, that I actually think that needs to come concurrent with the program development, and that there's actually a lot of work that has to be done before you can actually do that, before you could write the grant objectives, because I don't think it's actually possible to write achievable grant objectives or program objectives until you have an understanding of, I guess what public health would call a needs assessment, but actually understanding where communities are and understanding community readiness. Not that communities aren't ready to deal with or grapple with all of these really complicated issues, because they already are, but that different communities are more ready for different topics because it might be something that's more pressing to them. And because we know there are so many things that contribute to environments that result in sexual violence, like racism and food deserts and like all of these really serious issues, I think it's important to figure out how can we approach sexual violence prevention in a way that's really immediately and potentially physically relevant to the community that we're working with. And in order to do that, you actually have to go talk to people. So sometimes, even whenever programs have realized, oh, I should know who I'm working with, or whatever, sometimes that task gets delegated to whoever has the lowest title position. But then that person is not necessarily going to be the person who's actually implementing the programming. And I think that creates, it doesn't necessarily build trust well with communities. Like if you're working in a community or with a marginalized community, not necessarily a physically regional community, that doesn't have a lot of trust with the agency or isn't used to working with agencies in that way, that it's important to meet those communities and people where they're at and take time to build trust with them. One of the programs that I haven't implemented, but it's one of the most incredible community building programs I've ever seen, is the Purdue LGBTQ Center. They have this program called Fabulous Fridays. And it's just where they invite students, faculty, and staff and everyone to come and join them for something that's related to crafts. So, sometimes we've had, the 90s melty beads. Like, I built a unicorn out of 90s melty beads. They're just really silly activities, but from a public health standpoint, not only are they doing something like arts-based that is potentially stress relieving, but they're also getting students to have face time with mental health professionals, support staff, and other people who can actually support them. So if they end up in crisis or they are worried about ending up in crisis about something, they've already had that face time with somebody to know that that person or that office is a resource. So they're also like resource building, networking people, and the other thing also in terms of just literally community building is you get people from so many backgrounds that come and want to participate, and they don't necessarily have to have anything in common with each other, but it gives people an opportunity to physically be there for a reason, but they're also getting to build friendships and connections and other things. And we know that having community cohesion is a really big protective factor, particularly for marginalized and multiply marginalized people. So that program is just incredible. And it's so much fun too. Like, it's so laid back, and they've only had it for about a year, but now it's like the space gets so crowded. Like, there's just so many people doing so many things. But the point is just that I think that evaluating those things, so the LGBTQ Center, I don't know necessarily what their evaluation practices are, but they could not only evaluate the increase in people coming, but also what are the backgrounds of the people, what are the conversations that happen. I frequently go there just to do like outreach basically with students and stuff, and it's so informative to understand like what students are going through and what they need and everything, and I'm not asking anything of them. I think a lot of times people make the mistake of either in research or in programming that they want to go out to the community and immediately have community buy-in, and people sometimes don't think that gathering data on people is gathering, like you're taking something from the community, and by having people be involved in that evaluation development process, that you're actually increasing community buy-in and trust. People are more willing and ready to participate in whatever programs you end up doing, hopefully collaboratively and together, and that it just gives you a lot more meaningful data and access to folks, and it's also respecting the fact that you're asking something of people, and that you're reciprocating that through a relationship and collaboration. I think one of the most valuable skills for everything that I do in life, but particularly evaluation, is the importance of how I phrase things and the language that I use. This is something specifically that I've learned from my supervisor, Kimber Nicoletti, because she's amazing. I think whenever I started this work, I didn't realize how white my context for working with people was. And one of the things that I've most realized that is very heavily divided by race and background is that things don't have to be directly stated to be educational or learned, right? And whenever I'm working with people, I don't need to directly ask someone about risk and protective factors to gather information about risk and protective factors, right? Like, other people don't have that background, and part of what makes me better at what I do is being able to switch my language based on the communities that I'm working with and people's educational backgrounds and everything else. And that particularly I think a lot of communities either just don't respond to the words sexual violence, and or also that almost everyone responds better to a positive reframing of what you're looking at. So I think in prevention work, we focus a lot on essentially like the risk factors, like these things are bad, we shouldn't be doing these things contribute to hostile or violent spaces. But we don't focus enough on replacing that with positive things. So a lot of times whenever our program does workshops, we focus and we call them things like having healthy communities or having healthy families, or those types of things, because that is actually what we're working towards. And if we named everything preventing sexual violence, like nobody would come, because people don't really understand how that's related to healthy families and communities necessarily, or and it's hard to make those connections because we live in a society that specifically and intentionally removes the connections from those things. So in framing things in a positive way, and also often trying to collect data and speak to people in more indirect ways, I think is a lot more effective.